epilepsy should be informed of potential effect of the drugs on the acute and on the long-term effect. So in general, what we should know, what we should do is, if it's possible, we know that during pregnancy, anti-seizure medication dosage will be higher than because there was a change in the body and so on. So after delivery, it's important to measure the anti-seizure medication level, and if it's possible, to reduce. It's also important the time of breastfeeding, because we know that the breast is like in a dynamic equilibrium with plasma. So the peak level of the drugs in the breast is related to the peak level on the serum. So it's important also to suggest to breastfeed the child, for example, before taking the medication or before the long sleep period of the baby. And if we suspected an exposure, for example, if we suspected sedation of the baby, for example, we could dosage also measure the anti-seizure medication in the breastfed infant. And if there is a high level, we could suggest combining with some formula feeding. And also it's important sleep deprivation in women with epilepsy, because we know that sleep is an important risk factor for seizure recurrence. So it's important to ask help from a family member to help, for example, during the night breastfeeding, and also avoid situation in which a possible recurrence of the seizure could cause or could put the child at risk. For example, not bathe the baby alone, not share the bed with the baby, and so on. So what we should say is breastfeeding, the possible effect of breastfeeding on the child of women with epilepsy is really low regarding the possible acute and long-term adverse effect. So for all these reasons, we should encourage our women with epilepsy to breastfeed, because breastfeeding has a lot of beneficial effect that was reported from different literature data.